Welcome to the Minority Business Report, where we talk about positive things that are happening in Anne Arundel County. I am Joanne Jackson, Anne Arundel County Minority Business Enterprise Coordinator. My guests today are Dena Jackson, Director of Supply Chain Management at the Anne Arundel Medical Center, and Pernell Williams, CEO of District Healthcare Incorporated. We are delighted to have you on our show today during this joyous month of Black History. Before we get started, would you tell our viewing audience a little bit about yourself, where you are from, and what it is that you do? I'll start with the ladies.
Yes, good morning, Joanne. Thank you very much for having me today. My name is Dena Jackson. I am the Supply Chain Director at Anne Arundel Medical Center. I've been there just under 5 years. I've lived in the state of Maryland for about 25 years. I'm originally a Southern California girl, so struggling a little bit with the winter. But I'm married. I have 2 boys, one who's in his junior year of college and a younger one who's finishing up his junior year in high school. So I'm very happy to be here and look forward to talking with you.
So where'd you go to school?
I went to school at Sojourner Douglas College. I actually finished up my degree in healthcare administration there, and still debating on whether I'm going back or not.
Oh, glad to have you here. Pernell.
Good morning.
Good morning to you.
Thank you. My background, CEO, District Healthcare. We've been around for about 30 years. Started the company in 1985. Before I started District Healthcare, I worked for a number of pharmaceutical companies, Bristol Myers, Johnson & Johnson, and my last job was with Medline Industries. So that kind of introduced me into the healthcare field. Mm-hmm. In terms of my education, I'm New England, so the Patriots won, but I was still pulling for Seattle, University of Connecticut. Mm-hmm. And I've got 2 sons, I'm married, and both go to the University of Maryland, sophomore and senior.
And I've known you for a million years, Pernell.
Well,
where are you located now?
Our office is actually located in Atlanta, Maryland. We also have a location in Medley, Florida.
Okay,
so,
but you actually live in Anne Arundel County.
I am a county resident.
Welcome, welcome.
Thank you.
Years ago, the Anne Arundel Medical Center collaborated with the Anne Arundel County Minority Business Enterprise Committee to host a Minority Healthcare Forum. The forum was designed to bring hospital administrators, businesses, contractors, insurers, and physicians together for an evening of networking and information sharing. One of the hardest tasks at that time was to identify the individual responsible for supply chain management or purchasing. So I'm very glad, Dena, to have met you at that evening event with the City of Annapolis. Can you talk in more detail about your areas of responsibility as the lead administrator for procurement at the medical center?
Sure, be happy to. So I have responsibility for all of our purchasing, all of our sourcing, and all of the contracting for the organization. In addition to that, I have responsibility for what we call the logistics side, so distribution, the actual moving of the boxes. So receiving all of our storage, distributing the product to the nursing units. In addition to those areas, I also have responsibility for mail and our print shop. We have a brand new print shop actually that we just built that we're very proud of. And then I also, a little outside of what's normally within supply chain, I have responsibility for sustainability for the organization. So Anne Arundel, when we built our new tower back in 2011, we were awarded the LEED Gold certification for the green building that we built. So it's a beautiful building. I'd be happy for you guys to come over and check it out. We're also very proud of that. So at Anne Arundel, we have just under $200 million in spend per year within supplies and services. We are the 3rd largest hospital in the state of Maryland, so there's a lot of patients that we're responsible for taking care of. So all of that purchasing of whether it be supplies or services comes through my office, and between me and my staff, we manage that on a daily basis.
Do you also have responsibility for inventory control?
Yes.
And but not the pharmaceuticals, mostly just the supplies.
Just the supplies. I do some contracting for our pharmacy department, but they're kind of independent. They do their own ordering through our main distributor and are responsible for moving that product through the organization.
So would you say you have a centralized purchasing process, or are the individual divisions allowed to purchase on their own?
Primarily, we're a centralized department. We do have many off-site areas. We have a physician enterprise that is responsible for managing our physician practices, some of which we own, some of which are privately owned by physicians, but they've contracted with us to manage their practice for them. They do some independent buying, but the majority of the contracting behind that buying is done by my office.
That's great to hear. So we
Yes.
know she's the key.
She is the key. It opens the door.
Businesses come and businesses go, but District Healthcare has weathered the ups and downs of a changing economy. And as a minority business, I salute you for your perseverance and your ability to reinvent yourself and your company for sustainability. I would also mention that District Healthcare has been serving the Anne Arundel County community for about 10 years. Pernell, tell us more about your company and why you decided to go in this particular line of business.
Well, starting out in pharmaceuticals gave me the background already in the medical field. And then when I started getting into the supply side with Medline, I thought that was an area that I really enjoyed. But throughout the years, 30 years is a long time, as you talked about, we've known each other for a number of years.
But it goes quickly.
It goes very fast.
Yeah.
There's been a lot of changes in healthcare.
Yeah.
You know, there used to be opportunities where there would be local bidding with some of the smaller suppliers as well as the larger ones. But then with the GPOs coming into the
Now,
to the
we have
industry.
another audience. You have to break that down, GPO.
Okay, group purchasing organizations,
Okay.
where many of the hospitals look at it as if, as a consumer, you have your large clubs like a Sam's Club. So now you have all of the hospitals coming together with their large volumes of purchases, and they're being actually put together under a contract, which is called a group purchasing organization. And so with that, we had to reinvent ourselves. We're no longer just doing medical supplies, but we're also an integrated company where we provide safety and janitorial. Janitorial has been the route that we've been most successful in the healthcare, and that would be things like paper supplies, can liners, chemicals, things of that sort, simply because we find that many of the hospitals are buying it on a local or regional level. We also have gotten involved, and we're doing fairly well with private label manufacturing on disposable clothes, such as isolation gowns and shoe covers. We were providing products to Johns Hopkins, and we're in the process now of providing products to a hospital called Jackson Memorial out in Miami, Florida. So our company, District Healthcare, is more than just a medical supply company. We're integrated. And one of the things that I'm proud to be able to say is that we have now been awarded a contract for distribution. So when we start talking about sustainability, we start talking about things that would provide new avenues of being able to provide services. We looked at distribution as one of those. MedAssets happens to be the Maryland Hospital Association's group purchasing organization that they use. So we're hoping with this year being 2015, and we start talking about sustainability and going forward, that the contract for distribution will allow our company, District Healthcare, to be able to have access of providing supplies to the area hospitals here in the state of Maryland. I mean, it's all about Maryland, and it's all about the local economy, and it's all about regional contracting, and that's what allows us to be able to be where we are.
Well, tell me a little bit about your contract with Anne Arundel County.
Okay.
And how did that come about?
Oh, thank you. And that's one thing I failed to mention. We also have a home health care division. We've tried to be able to do as much as we possibly can in health care. And one of those things have been dealing with the incontinent indigent population. Anne Arundel County has put out a bid. We've had that contract for a number of years. We provide the incontinence supplies at home. We also provide them with the equipment. So it's been an ongoing contract. And it was put out for bid, and there was no type of preferences given other than just being competitive. And so that's been ongoing for a number of years. It's probably been about 7 years now.
And I've known you longer than that, so.
Well, yes. You're right, quite a bit longer than that.
So I'm really glad to see that you're still one of our vendors here in Arundel County.
Yeah, we're bricks and mortar, but that's still necessary. We have trucks, we have people, and now we have a contract that hopefully Anne Arundel County and the hospital here will be able to utilize in supporting the Maryland Hospital Association in their GPO.
Yep.
MedAssets. MedAssets is the GPO that you all support.
We're Premier Hospital. Premier is our group purchasing organization. So very similar setup to MedAssets, but we do buy off of some MedAssets contract because of their relationship with the Maryland Hospital Association.
Okay.
So we'll
Great.
definitely look at that.
As an advocate for small and minority business owners in the public sector, my office is in a continuous process of trying to increase utilization of minority firms. It is the policy of Anne Arundel County to assure all persons seeking to do business with the county equal opportunity and access to participate in the procurement of all goods and services. The Maryland Hospital Association has developed a women and minority business-owned initiative designed to improve the hospital's utilization of minority and women-owned businesses through education, policy development, and partnering. As a member of the association, Dena, does the medical center have a policy regarding supplier diversity? And if so, what are some of the things that you do to achieve your supplier diversity objectives?
Yeah, so we do have a policy around the way that we bid or that we source the supplies that we buy. One of the things that we know is that we have a lot of work to do in that area. Our spend as a percentage of our total spend within the women-owned and minority-owned businesses is not as high as we would like it to be. And it's a lot of it is the reasons that you talked about. When you're tied to a GPO, excuse me, you kind of choose from the portfolio of contracts that they offer to you. And when you're talking about $200 million in spend, we just don't have time to go out and source every single contract. So that's why we have a GPO that can do that for us. And so we usually pick from that population. But we are committed to increasing our diversity spend. So we've, are looking for multiple ways to do that. Within my GPO, Premier, as we talked about, I actually sit on the diversity contracting committee. So Premier does have a diversity supplier portfolio within the group purchasing organization. And I've been on that committee for a couple years, and one of the things that we talk about is it's very difficult, and we talked a little bit before we sat down here, it's difficult for small businesses to kind of get into that big world of national contracting within healthcare and then get contract uptake, to get folks to, and it becomes a balance of getting customers, picking up customers through the GPO, but then having the infrastructure and the capacity to handle that work. We see a lot of vendors that come through and they might pick up a little bit of it and then they just can't support it, because it's not always about price. Price is important. We want to be able to get to the lowest price, but it's more about quality and making sure that we have what we need to take care of the patients that we're responsible for taking care of. So we have to make sure we maintain that balance between having that low cost and but ensuring we have high quality, not just product, but service. So we struggle with that a little bit. So we're working on making that better. Anne Arundel Medical Center, I'm not sure of the year it's been, I guess 5 years ago was part of the, when they started Vision 2020, made a change to our vision. And in addition to the items that we, quality and compassion that we had they added diversity as one of the guiding vision statements for the organization. So not just around how we staff, but around patient population and our physician population and the vendors that we choose to do business with. So we're working towards that.
Some of the vendors that are coming through Premier, where are they kind of located? Are there a lot of people in Maryland? Is it mostly East Coast? Is it national?
It's kind of national. It's all over the place. So Premier is a nationwide company. So they've got, I don't want to misquote the number, I think last I heard over 800 hospitals that buy under them, and they're all across the country and actually some overseas as well.
Well, in the life cycle of any small business, I'm sure, Pernell, that you've faced some daunting challenges as a minority-owned business. We know that the lack of access to capital, we know about maintaining an effective workforce, but I'm interested in hearing about your experience with the manufacturers. Can you tell us about that experience and how you've been able to survive where others have failed trying to maintain these profit margins?
That's a tough question, but
Well, you're still here.
yeah, I'm still here.
obviously
Well, God is good, and so I thank Him for allowing me to still be in this business. It's more than just business; it's a ministry. So when you're committed to the business, I think you'll see that success will follow. But our limited success and our sustainability has really been, as you said, working with manufacturers. We've become an integrated company. What was being said by you, Ms. Jackson,
Yes.
was that the GPOs, they have these pricing structures. However, we have had customers who have partnered with us, and I think that's an important word, by being able to take a look at what their pricing would be from a local company such as District Healthcare and what their GPO pricing is for certain groups that we feel that we're competitive with. If there's a cost savings, they've been able to actually go back to the GPO and say, we have a local initiative with our diversity spend here that we not only do we see that we can save money, but we're also supporting an area where we have a difficult time being able to meet some of our goals, which is in the area of our diversity spend.
Right.
I can tell you that that has opened doors for us by being able to provide private label products that are acceptable after an evaluation, and also offering services that guarantee a savings. We have a program specifically that we have with the University of Maryland. We've had that for about 5 years now. And so, and it's that's large, very large healthcare system, as you know. But all of the hospitals, primarily within their system, have converted to our can liner program.
Which is?
Well, it's the trash cans, okay, basically trash bags, which allows them to be able to, one, consolidate with their SKUs, and they get optimal usage and consolidate their pricing by supporting not only a local company, but the product itself. So we'll go in and we'll go through an in-service, we take a look at what they're using. And by the way, the interesting thing is that when you have only a set number of trash receptacles, but you've got all these different trash bags. And so we have a system where we'll consolidate the usage of those bags because you're only using 3 or 4 different receptacles. Why do you need all these trash bags? And so one of the things that's been successful with us is being able to go through each one of these healthcare systems, and in particular, University of Maryland, do the due diligence and being able to give them an assessment of what they're using, because no one's focusing really on that particular area. We're talking about trash bags. But we found as a small company that became our niche. And so when you go through that process and when we can save you money and also minimize the amount of waste that you are currently experiencing, it became a success for us. So we'd like the opportunity of being able to have Arundel Medical Center take a look at that. And we're encouraging anyone who's a member of Maryland Hospital Association to at least take a look at a program that's going to reduce your costs, reduce your waste, and also provide you with the opportunity to encourage doing business on a local and a diverse level with a supplier.
Well, my original question was, have they taken you through any changes in life over the years? Have your manufacturers really?
Well, you know what? Because of the consolidation,
make it or break it kind of
yeah.
thing.
Well, because of the consolidation, we've dwindled down the number of manufacturers simply because many of them are now on a contract, on a national contract. The interesting thing about that was, as we unfold or peel back, looking at who we did business with, it worked in our favor because those manufacturers that are not on a group purchasing organization are actually very aggressive and hungry to be able to do business with distributors like District Healthcare that are not on the GPO. And together we've been able to provide aggressive pricing that are not on contract, but could provide local savings to someone who's willing to be able to take a look at it from a diverse supplier. So it's actually worked in our favor. It's like we pruned back who we were doing business with. And so now we find a common reason to come together with those manufacturers that are not on contract. And they're looking for distributors like us who are not on contract. And we have access by hoping that we, as a diverse supplier, and they are usually a small business manufacturer, can come together and offer the best pricing and service and program. And that's been working with us. It's just a matter of being able to find a healthcare system who is willing to partner and being able to also let their GPO know that here's what we're trying to do, and if you can help us, we'll work with you. But if not, we have an opportunity where we have a diverse supplier with a product and a service that we're saving money on, and it's also helping us meet our diversity initiatives.
Now, in the past, weren't you MDOT certified? Weren't you doing a lot of work in the district itself?
We're still MDOT certified as far as in Washington, D.C. We don't do a lot of work in Washington, D.C. any longer simply because they have a commitment to working with those firms that are actually located in Washington, D.C. And that's why I'm excited about being here and being a part of MHA as a contracted supplier. So any hospital that belongs to that needs to do the same thing that Washington, D.C. is doing. We should be committed to those firms that are located right in the state of Maryland that can provide the services or goods that you're looking for. Because that, to me, is what business should be about, supporting those companies and those services that actually are in the community. We should reflect the community by being able to do business with banks, by being able to do business with local businesses, for the very same reason that the hospitals exist, because they're servicing those same individuals within the community.
I agree. It's called buy local.
Is that what it's called? Yeah. And that has been a challenge in healthcare. And I just ask people, not just people, but I just, just have, after going through a number of conferences, what are you doing in terms of medical supplies? I'm not talking about construction, I'm not talking about services, but the acquisition of medical and surgical supplies. Generally speaking, Ms. Jackson didn't give a number and she said, we want to do better, but less than 2% is being spent. And I think that the time has come, if you have a tool that you can utilize to be able to help you get to those numbers that you want, then you should utilize that. And so I'm really focusing on this MedAssets GPO contract that we were awarded, because I think it will allow hospitals who in the past did not have a way of being able to do business, it'll give them access to now taking advantage of that tool.
Like I said years ago, that was the most difficult part, was finding someone, you start peeling back the layers, somebody within the system, and you weren't here. It would have been very easy to identify a woman or a minority personnel, but there just wasn't anybody there at the time.
No. Can I say one more thing?
Sure.
I came in from the mayor's office. What you gave the slide presentation. Actually, I have it. It was emailed to me, and I said, "Well, this is great." I see what the city of Annapolis is actually doing from the mayor's office, and I think it's wonderful. And I think the challenge has been when it comes to medical supplies. How do we work with being able to not pay more on a local level, still be committed to the GPO contract, and also support the women and small businesses and minority companies on a what I call on a regional basis. And one way of being able to do that, and I've encouraged some, which are very few. I'm like bricks and mortar now. I mean, we're like a dinosaur, what I do, but there's still opportunities, is to be able to get on a GPO contract. We were on Premier. It didn't work for us, and there were a number of reasons why, but I think everybody's still learning how we can fine-tune being able to do better, even on a GPO level. But I really think with this new contract with MedAssets, because it's a distribution contract, will allow any member of the Maryland Hospital Association to be able to say, now we can buy through our distribution partner and still be able to support MHA, which is Maryland Hospital Association, as well as being able to support a GPO such as MedAssets. And we're keeping it right here in the state of Maryland, where I'm proud to say I'm a resident here in Arundel County, and also we employ people in the state of Maryland.
Which brings me to my next question for Dena is, what would a company like District Healthcare have to do to become a supplier for the Anne Arundel Medical Center or any other facility operating in the region? And can you explain the process for construction? This is something a little different. For construction contractors in Anne Arundel County who might be interested in either maintenance or capital projects.
So I'll answer the first
let's
part.
do
Right, I'll do the
district
first part
health.
first. So I think us meeting today, I think is wonderful. I think I've known about district healthcare for a while. I know there were some early talks, maybe a year and a half or so ago. I think it really does become, and you don't want it to sound unethical in any way, but it really does become about relationships. Because if if I'm looking at 4 different companies on a piece of paper and I run the numbers and these 2 are going to be the best deal for me, I pull in the rep and I pull in a couple samples and we work with our clinicians and they make the decision on which way we're going to go. There's not really a face behind that. And I think having, and actually I did I spoke on a panel at the Premier Conference a couple years ago with a group called the Exeter Group, which is a minority-owned business out of Chicago. They're an executive recruiting company. And they do have a Premier contract. And the talk that we gave was around partnering up with the right person. Now, I don't contract necessarily for executive recruiting. That's done through our HR department. And, they'll come to me to ask, are there any contracts we should look at? But it's not something that's on my radar on a daily basis. But by them having that partnership with me, I'm able to get them at the table with the right people so that they can then start to form those relationships with the folks in HR that make those buying decisions. So it's there's a bit of an art to it. So I think we should definitely have some more conversations. I actually love the idea of doing a and I think we talked about that before. I would be happy to host it at the medical center. And to pull, some local women-owned, minority-owned small businesses in the area in, and let's talk about how we can do business and how you can hold us accountable, because we do need to support the community that we're in, and we have the ability to do that. So it's just a matter of let's get it done. On the construction side, I'm not as involved on the construction side. We do have a director of capital projects. So I'll work with him on contracting, or we'll work with him on, we'll do all the purchasing of the equipment that they're buying if we're building. Like currently we're finishing up construction on a new site in Pasadena. But traditionally that is, and actually quite honestly, that's where the bulk of our small and minority business dollars come from. When you take our total spend and bump it up against, our vendors who are small or minority owned, we actually see the bulk of that spend in construction and in services. We don't see a lot on the supply side, so we're working to improve that. Well,
that's why when I approached let's do lunch, not just me and you, but maybe 5 or 6, 8 folks, maybe a few suppliers, just so they can come to meet you. You won't have the answer. I try to tell a lot of vendors, you don't always have the answer. There's not something always immediate that you can do, but you got to get to know somebody. You got to find out how the system works, what's the process. And so you could be the lead on that. And basically that's what we've been doing for years. I'm sure when that incontinence supply bid came up, I made sure that Pernell's company was on that list, and it works out that way. But if you didn't have the eyes and ears watching those procurements, and so
then you wouldn't even.
I'm just very glad that we met.
Yes, me too.
Plans for a new medical center in Prince George's County are moving forward, as are some of the massive housing and transportation projects, such as the Purple Line. So after 30 years of hard work now, what do you see your company, where do you see your company headed in 2015? And what new investments, if any, would you plan to make this year?
Well, in Prince George's County, I believe that hospital's been put on hold politically, okay?
Oh, really?
Yeah.
Okay.
I've talked to several people. We were positioning ourselves to be a prime vendor. Our warehouse and location is right there in Prince George's County. And so we felt that because the county does have a preference point system, but also because the University of Maryland Medical Systems was taking the lead in being able to manage that project. So we don't know where that's going to be at right now. But we were being proactive, me talking to several people politically, and you know, it just doesn't. I mean, I happen to know the president of the but he's on the board, but he's with the Sandy Roberts is with, you know, Sandy.
Yes,
Yeah.
Olympics.
Well, now they're no longer with Olympic Supply.
Okay.
But the point being, he informed me of some things. So right now, Prince George's County, as far as a new hospital is concerned, is on hold. But I will say, one of the things as far as investments are concerned is just finding the right people, because people make a difference in your business.
Yeah, absolutely.
You know, everybody has to be on the same page. And I have, my brother works with me. I don't know if you've met him.
Oh, yes, years ago.
Oh, yeah. So it's family-owned business, but at the same time, in terms of our investments, it's really going to be based on how we see ourselves in terms of getting some additional business. As I said before, we have an office in Florida, and that's been, Med Assets seems to be very, very, how can I say it, concentrated in the Southeast. There's like 4 or 5 hospitals right in the Miami area that are Med Assets accounts, Broward, just quite a few of them. But I guess the bottom line for us is, besides prayer, is that we're going to go forward and move with this Med Assets contract, meet people like Ms. Jackson, and hopefully the Maryland Hospital Association will make all of their members aware that we now have this contract. As a Med Assets member, or what I call shareholder, they should have notified you guys, your hospital, that we're now on contract. And you know, based on that, we'll either have to have additional trucks. That would be a blessing if we could. But more importantly, I think just simply continue to grind, to go out and build relationships. And if I might say, some of our best relationships we've had hasn't necessarily been with the hospital on a direct basis. It's been with their prime vendors, such as an Owens & Minor. We have a great relationship with them. And I think when you partner with other firms that are larger firms that are doing millions, if not billions, with the facility, it helps, whether it be first or second tier contracting. But where they're involved in the process, everybody comes together. It really, something good comes out of it. I don't want to be separate from your prime vendor. Your prime vendor and I both need to be at the table along with you as a healthcare system. And then all of us get together and find out how can we have an attitude of inclusion with the supplier. And that's been very successful us at the University of Maryland Healthcare Systems, and also at Johns Hopkins, where we've worked with their prime vendor.
Now, speaking of your brother, are there 2 divisions in your company? Not another name?
Yeah, well, he focuses primarily on environmental services, the Jan Sand side.
Okay.
That's his background, and he has a great system of being able to reduce their costs when it comes to utilization, optimization, standardization, those kind of things that have to go into that most people don't consider, things like can liners. So it's a great program. It's a guaranteed cost savings program, I might add. Most people can't offer a guarantee, but we know the business so well, we know exactly how to be able to reduce your costs. I focus primarily on med-surg. That's my thing. As I said before, we do private label contracting. I know a number of manufacturers and owners who are small business manufacturers who will private label things such as the powder-free nitrile gloves. We're in the process of now of saving a hospital, Jackson, about $150,000 a year. That's a lot of money for one line item. But just being able to have the opportunity of being able to say, this is what you do, and you private label. And by the way, the manufacturer we're using also private labels for a large, I'll say, integrated company like a Cardinal. So some of these manufacturers, we're using the same manufacturers. We're going to the same plants in China. It's just a matter of how we have our pricing structure set up. And so once we get an opportunity, I think the best thing that can happen for us in this year and going forward is for someone will give us an opportunity of being able to come in and present our program on a supply side, and then give us an opportunity on the distribution side as far as the supply chain is concerned. And I think in the end, that's the best I can hope for, is just being able to give an opportunity where we don't have those opportunities now.
Are you familiar with Sodexo?
We do business with Sodexo.
Okay. Okay.
See, I'm glad you mentioned that. They are a large business partner. As a part of their contract, it's a requirement that they do a certain amount of business with certified MBEs. And because they do a lot with food service, that's the area that we actually provide them with products for.
Because they are a member of the Minority Supplier Development Council, and that's one of their strong partners. So good. Are you a member of the Minority Supplier Development
I've been one
Council?
for since Jesus was here. Okay, but
Don't let him strike you down.
Darlene Fuller is the person that we deal with.
Yes, I know Darlene.
I'm sure you do. And so, as a matter of fact, we do the contract is with Jackson Memorial Hospital, and it seems like we've been able to be successful outside of the region, and that's a little embarrassing and somewhat hurtful, simply because they have a different commitment, I believe. And they also have different.
Now, who is this?
Jackson Memorial Hospital
In Florida.
in Florida. They're very committed, and their contract language includes a certain percentage of business that's being done with local certified MBEs.
Right. And actually, just to piggyback on that, the Maryland Hospital Association attempted to do that several years ago. Actually, I think it was led by Sam Ross, or Dr. Sam Ross, who's the CEO at Bon Secours, which is where I was before I went to Anne Arundel, and wanted to try and take some of the requirements for Maryland contracting, for state of Maryland contracting, and apply those to the hospitals. And that's kind of, I think, where that minority business initiative came from. But I don't think it went over very well. But if you look, I know actually the vice president of supply chain down at Baptist in Miami is very close to me. He's a member of Premier and sits on what's called their SAG committee, which is the Strategic Advisory Committee.
You're talking about Frank
Fernandez. Everybody knows Frank. So
Small world.
Small world.
right. So the requirements in the state of Florida, they have requirements where the hospitals have to buy a certain percentage. I know it's also very popular or not popular, but very closely watched in the state of Ohio, where the state, they actually, some of those hospitals just maybe a year ago at this point got into a lot of trouble because they came in and started auditing and saying, wait a minute, where's your minority spend? You're required to spend a certain percentage. So they had to,
And because certain hospitals are strongly affiliated with the state, like the University of Maryland,
like the
that's where you get that turnover. So as someone who's been in this arena for like 20 some odd years, it just takes time. And people like ourselves who are in the system, and you see it over time, you want it to be better, but it just takes time. And somebody like you who've been out here, you don't have time to pry back that. If it don't work for you, you move on.
I gotta go follow the money. And it's interesting because all these hospitals have Medicare and Medicaid.
Yep.
Okay, so that's federal money and state money. And oftentimes, I can only speak about a hospital. It doesn't tell them how to spend their money, but it's not narrowly tailored to any particular given area. The largest budget oftentimes is in construction. Well, no disrespect, we shouldn't have to be limited to just being able to, drill holes in the dirt and do those kind of things. If you're a hospital and you're buying medical supplies, why aren't you looking at that area and med surg and saying, I want to be able to, you're issuing all these contracts, and in these contracts, even if you have a subcontracting arrangement, it's still not tailored to those suppliers that are in healthcare. Well, I can't go into construction. You follow me? So therefore, if you're doing millions of dollars with medical and surgical supplies, why aren't you at least doing something in the area of those companies that do nothing but medical and surgical supplies? But oftentimes, they can get their numbers simply because it's not narrowly tailored to a particular contract. So you might be able to have a contract and say, we're doing diverse spend, but we're doing it with personnel. We're doing it with printing. We're doing it with you see what I'm saying? And so those are the things that throughout the years I've had to combat. But there's always a ram in the bush. And right here in the state of Maryland, I openly say that the two healthcare systems that have been very supportive have been University of Maryland, because it's a state. And thank God that's my kids go to the University of Maryland, the school. But also Johns Hopkins. Ken Grant has been very proactive in being able to try to have a sense of inclusion. He's also on the board with MHA. So he's unaware of us having this contract, and I'll be talking to him soon. But we're putting together as many tools as we possibly can to be able to give you access to being able to do business, not just with our company, but with any company who has taken the time to give you these tools and information to help you build relationships so that you can, in fact, do business. Because right now, I'm probably one of maybe two, if at best three, that I'm aware of in this metropolitan area.
Yeah, you're almost like the only one left. The only one that I know, Pernell.
Well, I'm not that smart, so that's why I'm still here.
Right. As we close out this segment, what recommendations of words of advice would you give companies interested in doing business with Anne Arundel Medical Center, just in general?
I think it goes back to what I talked about in the relationship piece. And I know I say it and it sounds easy, but it's not an easy thing to do. Unfortunately, fortunately or unfortunately, we're very, very busy. There's a lot of stuff going on all the time. You would be surprised at the velocity at which a hospital moves, and it doesn't ever really stop. We don't have a slow season. It's just constant. And with all of the changes that are coming with healthcare reform, and I mean, the real push is, how do we lower our cost base? So as a minority business, it has to be about how you can help me do it less expensively, better, faster, quicker, more efficient. Because I mean, we're working, and have been for the last few years on reducing our cost base, because we don't know what the HSCRC, the Maryland State Commission, is going to do as far as reimbursing hospitals. If they just redid the waiver, so I think we're okay for a couple years, but our leadership has been very visionary in understanding that we're going to get to a point where we're going to have to be able to do what we do every day with a lower expense base. And you don't want to always be talking about money, because of course quality is number one. But if we want to be providing quality care, we have to be smart about our resources and how we spend them. So we spend a lot of time focused on that, and how do we continue to pull dollars out of the supply chain. So that being said, but we also want to be fair. We're willing to pay a fair price for a fair product. So, it's the relationship piece, and understanding that, if we don't call you back the first time or don't answer the email, it's not that we're blowing you off. Keep bugging us. I'm notorious for that, not answering my emails and my voicemails, but sometimes it takes a couple times of getting to me before I can say, yeah, you know what? Okay, let me stop what I'm doing and really focus, and let's have that conversation and figure out what's next.
I think one question I didn't ask, is there at any point within your system, do you advertise the bids or certain items so there's nothing on the website that anybody could look for?
There isn't, and we've talked about whether we want to be able to do that. So we do have a contract calendar that we work out of in my department. So we know, in May of this year, every contract and for what commodity is that we'll be working on. And we usually start working on it in 120 to 90 days out, depending on what it is. But we don't publish that. I know there are some, I don't know if there are any hospitals in Maryland that do. I think Hopkins might do with some things, but not everything. So it would be a matter of figuring out, kind of what's the best way to get that published, and then, let folks know. I know years ago, when I was at Bon Secours, there was a group that the Greater Baltimore Committee created, and I think you were a big part of that.
GBC.
The GBC, and we did the Bridging the Gap
Bridging the Gap,
program,
yep.
which was, I thought that was phenomenal. Ken had a huge lead in that, in trying to pull the hospitals in the city primarily together to say, what commodity can we look at that we will
Right.
take all of our dollars and give it to one company and give them the ability to build infrastructure and hire within the city of Baltimore? Was, at that point was kind of the big. So I would actually love to see us do something like that again. I'm not sure that and I haven't been involved in it. Actually, we were talking about that somehow or another. It's interesting. There's besides Ken, there's a couple African American directors within the supply chain, and the couple that I know, we were like the two people that didn't get invited to the latest forum that they did. I just don't think we've made it onto the distribution list somehow or another. But I think that not issuing a mandate from Maryland Hospital Association, because I think they've tried that and it didn't work. The hospitals are very independent, and they're going to want to do their own thing. But if we could put together a group like that again, maybe in the Anne Arundel County, and I don't know how far out we would want to go, and see if we could get something like that stirred up again. Yeah,
But
always.
if you don't do it consistently, and it fades. And
Yeah.
then, like,
People
now that we have
change, and
Dena,
people change,
it'll come
and
back up, and then it'll fade again. So there's no promises for anything out here. You just got to keep plugging away and working at it.
But it's a good concept, and I remember working with Don Fry at GBC. That's how can liners came to be for us. Everybody's using trash bags. It's the low-hanging fruit, and there should be some type of, so listen, do we have companies that can just do trash bags? Everybody buys gloves, okay? So when you find an area, that's a commodity. That's based on, the thickness, the size, but it's not that difficult. But if everyone, just imagine, said, listen, no, we're committed to this contract with this diverse supplier for trash bags. And you're not paying anymore. It's a win-win. Those are the kind of things that I think make good business sense. And along the way, you build relationships, and then you go to the next area, shoe covers. We're not talking about high-tech things. We're just talking, shoe covers, you just put the booties on, and I've been, selling these things for a number of years, but you're right. There has to be some type of at least an initial opportunity being given. What harm does it do to be able to see exactly what your product and your pricing is compared to what we currently have now, especially if you happen to be a local business, a woman-owned business, a Maryland-based business? I think it opens the doors for being able to create at least some dialogue that makes good business sense. And that's what we've been successful with. And that's because of GBC, Don Fry, Ken Grant, as you know, who was helping lead that. And we always felt that if you can't do trash bags as a, quote, diverse supplier in the healthcare field, it's going to be very difficult to start talking about instruments or other things. So we started off with the low-hanging fruit, and that's been our success story.
So my question to you as we're closing is, what advice would you give to anyone who wants to start a business today?
Well, I think, first of all, they should do their homework. You really have to look at the market, as we've seen here. I wouldn't encourage someone to go into the medical supply distribution business at this point in time in healthcare because of how it's changed. But I would encourage any entrepreneur to be able to, first of all, think about the dream that you're going to pursue, because we can have a passion for oftentimes the wrong thing. The passion is still there, but it's the wrong service, it's the wrong product. So do your homework, be committed, and as I'll say, Ms. Jackson said, build relationships along the way. Because those relationships, actually, they can help you by telling you where you need to be and not where you ought to think you ought to be. A customer who you built a relationship with, a manufacturer that you built a relationship with, a person that you built a relationship with, oftentimes will guide you where you may not be able to go without having their assistance. So That's the key, I think. Do your homework, be passionate about it, and build relationships along the way. And keep God first, of course, God first in everything.
I agree. Thanks, Dena and Pernell, for your insights and recommendations. Stay tuned to Channel 98, Verizon 38, for the Minority Business Report airing at 1 and 5 every day. If you have any comments or suggestions regarding this edition of the Minority Business Report, please contact me at the Office of Central Services in Annapolis on 410-222-7620. We are here working for you. Peace and blessings. The following bids are available from the Anne Arundel County Purchasing Office.